This meeting to order. We have an updated agenda because we had some last minute changes. Let's start the meeting with a roundtable of introductions. Let's start the introductions with our phone callers first. Hello, is anyone on the phone? Well, I knew Mindy Bentley from Advantage and was there. She said she's traveling in and out of reception. So I'll start the introductions. I'm Arvinder Singh, Chip Coordinator, Lake County. You wanna go next, Diane?
Diane Clay, and I'm with the Lake County Food Chair and the Hospital Auxiliary.
I'm Janine Sims. I'm with the Lake Health Clinic. I'm the care coordinator nurse.
I'm Margot Dodds. I'm a nurse at the hospital, but I'm here today as a friend of the Lake County Library to talk about the Dolly Parton Imagination Library.
John Adams, Eastern Oregon Healthy Living Alliance.
Janet Larsley, I'm in the hospital auxiliary, and I'm here with the library.
Hi, I'm Gloria Now. I'm the director of the Crisis Center here in Mountain
Brooke Kelleher with Food Corps.
Jamie Davis with OSU Extension Service.
Darwin Johnson, Lake County, and Town of Lake.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinating Care Organization.
Francie Winters, Prevention Coordinator, Lake Health District Wellness.
Christy Albertson, I'm the grant writer for Lake Health District.
Alana Shamulak, and I'm with the Eastern Oregon Healthy Living Alliance.
Rod Harwood, Older Adult Behavioral Health Specialist for 8 counties in Eastern Oregon, and I work for Greater Oregon Behavioral Health Incorporated.
I'm Susan Campbell. I'm the clinic manager for Lake Health.
I'm Cece Montgomery, and I'm with the seniors and library, principal library.
Thank you. Let's take a few minutes to go over the November minutes. I would like to make a motion to approve the November minutes.
I make a motion to approve the minutes as presented.
Thank you, Cece. Anybody who wants to second the motion?
I'll second it.
Thank you, Diane. All in favor say aye.
Aye.
All opposed say the same sign. Thank you, the November minutes are approved. Next we go to the Healthy Living Alliance update. John, can you give us the update?
My name is John Adams. I'm the director with the Eastern Oregon Healthy Living Alliance. I come out here periodically to give updates on our organization and our work. I know Alana, our program coordinator, has come out and joined you guys and given updates. Singh is on our board, and he also works to give updates. Every year, we like to come out and spend one meeting with you guys where we go a little bit more in depth into our work and hear more about your guys' work and talk about how we could be supporting you guys and working together. So I came out around this time last year and introduced this new nonprofit organization, and I'm recovering from a 36-hour migraine, so I'm really weak, and you have to excuse me a little bit here.
Want to sit down?
Oh, no, I'm fine. I came out last year, we introduced this new nonprofit organization, and I wanted to give a brief overview for the folks that weren't able to join us last year. You have to, yeah, you can move it forward. So we formed, this new nonprofit formed officially in August of 2014 by the EOCCO's Regional Community Advisory Council. The reason we formed is because we understood that throughout the region we had shared health priorities. Oral health, mental health, early childhood health, chronic disease. These are issues that are shared amongst the community advisory councils throughout the EOCCO region. We also knew that the community advisory councils were struggling to be able to fund all of the strategies within their CHIPs. And so part of the purpose of this nonprofit is to support the community advisory councils by raising funding and providing program for these shared regional issues. So our mission is to improve community health and support attainment of the highest level of health for all people in Eastern Oregon by engaging community advisory councils and other partners and leveraging resources to impact regional health issues. So we focus on the health priorities and the strategies that are part of the EOCCO's Regional Community Health Improvement Plan. Last year was the first year that we provided new programming, and we focused on oral health with a school-based oral health program similar to what you guys are doing here. Ours is called Healthy Happy Smiles. For chronic disease, focusing on colon cancer screenings. Mental health, providing mental health first aid trainings. And for early childhood health, doing some work around the Integrated Nurse Home Visiting Program. When we formed this new nonprofit, we developed some guiding principles to help us to successfully launch this new organization. So we knew that we wanted a regional collaboration focusing on regional issues. We knew that we needed to create a new nonprofit organization that had the scope of the 12-county EOCCO region, and so that we could partner with other external or outside organizations, including academic, research, policy, media organizations, and certainly funding organizations. Appropriate budgeting refers to making sure that we have adequate funding to provide quality programming. Equitable resource distribution, so we value sharing the resources and making sure that everybody gets some of the resources, but also taking into account needs based on population and needs based on where the data says there's the greatest need. And then finally, this nonprofit is also a vehicle to bring resources and programming beyond just the OHP population and to serve the broader community as well. Next slide. Next slide. So last year we provided something similar to this, and it's a summary of our 2016-2017 activities, and then our outcomes for our programs in 2017. So on the left is really a focus of our work within our organization. On the right is a focus of our work out in the community. So on the left, you can see that we work with a governing board. We outreach regularly to the community, mostly through the community advisory councils. We provide programs, provide communications, maintain the operations, and raise funding for our programming. In terms of the outcomes, so these are the main programs that we did some work around this year. And I'm actually going to be talking, I'm not going to walk through this, I'll be talking a little bit about our outcomes as I walk through this December handout.
Now, what's TFFF?
For Family Foundation.
Oh, okay.
So every month, we like to provide this handout and share it with the community advisory councils, and it just gives an update on our recent activities. And I'll essentially just be walking through this So looking at, so Healthy Happy Smiles, school-based oral health program, very similar to what you guys are doing here. Provides free dental screenings, fluoride application, dental sealants, oral hygiene education, and follow-up for kids identified with urgent dental care needs. We're providing this program in 4 southeastern Oregon counties, so Harney, Grant, Baker, and Malheur counties. We're in the middle of the 2017-2018 school year, but we've completed many of the services, and Alana has been, she's been working to schedule the learning lab with several of the schools still. So we've provided the numbers here just in terms of where we're at this point in providing this program. Again, this project won't be completely finished until the end of the school year. But these are the numbers for now. And I just want to give you guys our goals for, internally we set goals around, so the parent consent form. So the parent consent form is really key. We need parent consent to be able to provide any of the services. And so everything flows from our ability to be able to collect those parent consent forms. So screenings are at 55%, and then fluoride at 40%. And then the sealants, we work to just to achieve the EOCCO numbers in the participating counties. So you can see, so these are our numbers, just our own benchmarks around the parent consent forms, the screening, and the fluoride. So you can see how we've done compared to our benchmarks for Harney County, meeting all the benchmarks. Grant County, strong numbers, but not quite meeting all those benchmarks. Baker County, so we met all of them except we were 2% shy on the parent consent return rate in Baker County. However, we saw significant increase in the participation in Baker County over last year. And then Malheur County, kind of similar to last year, we had lower numbers, lower participation in Malheur County. We still have several schools that we need to provide the services to. And we've already seen a drastic improvement over last year's numbers. Overall, so if you take all of these numbers and you look at how we're doing project-wide, so our parent consent form rate is 54%, which is up 21% over what we did last year. The screenings, again, we're not complete, but where we're at right now, we're at 37%, which is already a 5% increase over last year's numbers. And we'll see that number go up because we have several schools remaining. 33% for the fluoride application, which is an increase of 10% over last year. Again, we'll see that number go up because we have several schools remaining to serve.
Can I ask a question?
Yep.
Are you guys doing anything different, or did you do anything different this year versus last year, or just you've been around longer, or people know what to expect, or what's the?
This is the main increase I think comes from getting the consent forms integrated into school registration packets. When the consent form is in with all the other forms, parents just assume it's required to fill it out. Also having someone sit at registration if they have an actual registration where people follow through, they can answer questions, and then the offering of the incentives. So teacher incentive has been really big. The teacher with the highest percent return rate for their classroom through all grade levels. It varies school to school how they want to do it, but they get a $50 Amazon gift card. That's been a pretty big motivator for some teachers. And then student incentives, all of the elementary kids received a tooth timer if they returned a consent form, and then 7th through 12th graders, if they returned a form, got entered into a drawing to win a gift card. It was a $10 gift card, usually to a local coffee shop or wherever the school felt was appropriate, and we gave out 5 of those, so we did a drawing. So I'd say the incentives and the consent forms and registration were huge. And then partnering with local, like in Harney County, we're partnering with the ESD and their local dental provider. So having those relationships helps too.
So what are you doing different in Harney County versus Malheur County?
Harney County, like I said, we have that really strong relationship with the ESD. We couple the dental screenings usually with when the ESD does hearing and vision screenings. We also have a really close relationship with Burns Dental, so they're able to provide support, have staff come help with learning lab. And we're just really integrated into their registration and into their schools. Now, Malheur County, a few of the schools we were in this year, we were not in last year. So we were brand new to them, and Malheur County is kind of similar to Lake County, where you have these rural communities that aren't super welcoming of new people and new programs, and it takes a couple of years to make the relationships and get your foot in the door. And they also have these really large schools, like NISA, their elementary school has nearly 600 students. So it just takes a little bit to build those relationships and really, meet the right people and get in there.
Do you have anything, especially in Malheur County, culturally specific in their Latino population, because there are more Latinos than white kids in NISA and Ontario?
We actually did, I did my learning lab in NISA with the elementary school. I was talking to the PTA, and they said part of it is the Advantage Dental consent forms are 2 pages of English and then 2 pages of Spanish, all stapled together. And she said what they'll do next year is they'll just pull them apart, and they will give only Spanish to the people they know are only going to need Spanish, because chances are some parents would see English, flip the page, see English again, and just toss it in the garbage.
Yeah.
So hopefully that'll help next year.
So looking at mental health first aid. So last year we provided trainings to teachers and law enforcement, and we completed our project in March of last year and did 13 trainings. So we have new funding to continue providing mental health first aid trainings, continuing to provide them to teachers and law enforcement, and then we also want to expand them to include other public and social service employees and church leadership and other folks working with the older adult population. So we have funding to provide trainings up through the end of 2018. We've kicked off this project this fall. We've completed 4 trainings, and we've got several scheduled. So our goal is to provide 30 trainings by the end of 2018. So in Lake County, we organized a training in October with North Lake School District. So we trained 25 of their teachers and staff. We have a couple of law enforcement trainings that are scheduled here in town. January 17th and January 19th. And then we're also working to get a mental health first aid training with the schools.
Yep.
Is there an update
We're
on
working
that?
on it.
Yep.
I actually was just talking to Rusty.
So that would be
before I got here.
Lake County School District 7.
Yep. And we're going to invite the ESD as well. He's working on finding a date that works for staff. And we're going to try to get key staff members trained now, sometime hopefully early 2018, early spring, like counselors, maybe gym teachers, lead teachers for each grade. And then in the fall, we'll hopefully have another one that will be during teacher in service that will get everyone. So no date yet, but he's working to try to find me a date.
Down here, are the school bus drivers, who are they employed by?
The district.
chunk of them are pastors.
I worked at the school district for 2 years,
Yeah.
so.
And then we're planning on another training for church leadership and folks working with the older adult population. So we're working with Eric Sarensen right now and trying to get that scheduled. Colon cancer screenings. So we've received funding to provide a colon cancer screening project that's informed by the focus groups that we did in 2016. So we did focus groups in Lake, Harney, Gillum, Sherman, and Wheeler counties so that we could identify best practices to outreach to the community and try to increase screening rates. And so we've developed our project based on those recommendations. And we're partnering with 3 community advisory councils in Morrow, Sherman, and Gillum counties to improve their screening rates by 5% over whatever they end up doing at the end of this year. So we're looking at kicking that project off in February of 2018. So I am interested. I understand you guys are doing the opt-in project here. I'm interested in hearing about how that's going for you guys and learning from you all. Integrated Nurse Home Visiting Program. So this is a new program. Over the past year, we've worked on forming a collaborative or a work group or collaborative, developing this new service model, this new project, and developing a funding proposal. So essentially, the project entails integrating mental and behavioral health services with public health home visiting programs when risk factors are identified for maternal depression or depression. Because it is a new service model that's currently not being practiced in Oregon, we've developed a learning collaborative to support implementing this new project. So we're about 3/4 of the way through raising the funding for the learning collaborative. We just recently submitted hopefully our final proposal with the Ford Family Foundation to raise the final $33,000. We're looking at starting this project in March 19th, 2018. So we're going to focus piloting this project in 4 Eastern Oregon counties, so Umatilla, Morrow, Grant, and Malheur counties. If we have success, we'll look to expand this program to other counties in the region. Social marketing. So a while back, Ken Kessner brought this idea to the Regional Community Advisory Council that this idea around a centralized regional communications effort around regional health issues. This was supported by the Regional Community Advisory Council, and it ended up becoming a recommendation within the Regional Community Advisory Council's annual report to the EOCCO board. But we didn't want to simply go out and assume or impose a communications campaign on the communities of Eastern Oregon. We want to be able to engage the communities on the best way to outreach, to provide communications, to have media activities, to change specific health behaviors. And that's what a social marketing campaign is. Social marketing uses community engagement tools such as focus groups, surveys, review of quantitative data to develop media outreach and communication activities aimed at changing and improving specific health behaviors within a community or communities. So ideally, what we want to do is we want to identify one issue in the region that we can focus this social marketing effort around. So that's why last month we asked you guys to fill out the survey. Thank you for doing that. We're still waiting from a few counties to finish up their surveys. And then that'll help us to identify the one issue that we end up focusing this around. And then, so finally, just the other handout here. This is our annual giving letter. Every year, we reach out to our partners, the community advisory councils, and others to give to EOLA. It's through donations such as yours that helps us to do this work that we've done over the past year, and to continue building on this work. So I encourage you to give a donation to the Eastern, or to consider a donation to Eastern Oregon Healthy Living Alliance as part of your annual giving. Obviously, it's a write-off. Your donation helps to go towards funding things like toothbrush kits that goes to every child in the schools that we work with, and mental health first aid manuals. So we're not asking teachers and law enforcement and church leaders to cover the cost of those manuals. We're able to provide that for them, and other program costs. You guys, you can send a check to the address on the handout, or you can go to our website at eola.org, and there's an option to donate through the website as well.
Example, how much would a manual cost?
One manual is $18.95.
Do we have any comments or questions? Thank you, John.
Thanks, guys.
Next, we have Margot Dodds. Could you tell us, or talk to us a bit about the Dolly Parton Imagination Library?
You want there or be down here?
You can just sit there.
Okay. I'm here to talk about the Dolly Parton Imagination Library. The Friends of Lake County Library has agreed at their last meeting to partner with this foundation and send every month a high-quality classic children's book to the home of every enrolled child. Dolly started her Imagination Library to honor her father, who was illiterate when he died. So far, she's helped us send almost 100 million books into the homes of children. There's 100% participation in her home county of Sevier County, Tennessee, where she started it. As you guys know, there's a lot of children living in poverty in Lake County. We expect that right now, in 2015, there were 321 residents under the age of 5, and up to 49% were living in poverty at that time. There's a lot of information that children in poverty are less likely to be read to. They will hear fewer words, and they're less likely to be ready to learn when they arrive in kindergarten. These deficiencies will have lasting impacts on their educational attainment and on their success and income as adults. There are a number of studies about the positive impact of this program on reading readiness, and you can access that on the Dolly Parton Imagination Library website, which is on this bottom of this flyer here, if you're interested. All children in Lake County, ages birth to 5 years old, are eligible. There are no income restrictions. The program is available to every child living in Lake County. Parents are never asked for money. Enrollment can be done on paper or online, and the database is very secure. That information is never sold or shared. The program costs the community partner, in this case Friends of Lake County Library, $25 per year per child. We can't support this by ourselves, so we're doing fundraising. There is a private Oregon family foundation that has become passionate about the program, and they are willing to support half of the cost of this program in any rural area in Oregon that wants to sign up by June 2018. So we have agreed to sign up, and we're starting January 1st. But half of our costs will be covered for the first 3 years. And they may continue that into the future depending on how it goes. We plan to write grants for other financial support in the future. We need to raise $5,000 to cover our expected share for the first 3 years, because we we expect will gradually enroll more and more children. If we enroll 100% of the children eligible in Lake County, it would be $10,000 a year, and half of that would be covered by the Family Foundation. On the bottom of page 2 of the flyer, there's a spot for people to pledge financial support. We are also now able to take donations. What we hope that the CHIP group will do is consider supporting the project. Tell people about it, spread the word. If we could partner with your home visitors to go into the home and sign people up when they're already there. The hospital has decided it's really not effective to try to tell mothers about this right after birth. They're already overwhelmed. It's not a good time. But a month or 2 later would be a great time in the home. So I'm hoping that maybe the doctors and the clinics will also consider helping people enroll. And then if, I don't know if this group has money that they would like to consider making a donation at some point, putting it in the budget for another year. And of course, individuals who want to contribute are most welcome. You can mail checks to the library or give them to me. My name and email are on the flyer. And we cannot take things by, we can't, as far as I know at this point, you can't do donations online. You're not going to teach you that right now. Just anymore. Any questions?
Have you posted it on Facebook?
No, what a good idea.
Make a few announcements.
Great idea. All right. Thanks.
So there is a national program too that clinician offices have. I forget the name of it. Have you guys ever participated in it?
I don't think so, but I was gonna say.
Yeah, I know they did it in Enterprise and Baker City and a couple other big clinics, and it was basically, a book giveaway program that was funded kind of similarly, but linking it with the developmental screens might have some potential there, because then they are ready, right? So they're getting those developmental screens for the first 3 years of life, and the developmental screens are supposed to make them kindergarten ready. And that is likely to be an incentive measure, I think in 2019 or 2020, they say, is what percentage of your kids are, deemed kindergarten ready, because that's part of it, but.
The advantage of this program is the child receives a book in their home addressed to them every month. And the program has been going in Wilsonville for a number of years, and the librarian has only had 2 complaints. One was that the postman bent the book and the child was upset, and that should never happen, actually. The postman could lose their job, by tampering with mail or whatever. But the other complaint was a woman who said, well, I guess the program's okay. Well, what's the problem? Well, as soon as I get the book, he wants me to read it to him. And then he wants me to read it to him again. And she was like, oh yeah, that's good.
And the books that the child will receive are good quality hardback books. It's not a flimsy paper cover on it. It's a top grade book. And it comes straight to the child.
Actually, some of them are paper covers, but very high quality. And twice a year, every age group gets a Spanish-English bilingual.
So do they get to keep the books?
Oh yes, they're
Yes.
books. It's addressed to them, they're forever. And the covers have, information for the parent about how to, maybe activities that they'd like to do related to the book.
Do they all get different books, or do they get the same book for age groups?
Each age group, like I can pass this around. I find it a little hard to read myself. It's the reading list. The first book everybody gets is The Little Engine That Could, because that's Dolly's favorite, her theme song. So it's divided into groups what year you were born. And so every year they change, like the books that are going to the certain age groups. So there's variety, but I don't know actually most of these books, but I'll pass them around to kids people have little kids maybe, or grandchildren. Ask me in 2 years, I'll probably know more about it. Any other questions?
I have a question for you. So if I can get some of this information and how the families sign up, at some point,
Yes,
I can get with
yes,
you and
we
we
are
can implement that in the clinic.
Yes, exactly, and I can bring you all that information. We have, I don't think we've signed the memorandum of agreement yet, because we just voted, and so it may be done. We're hoping it's done by the end of this week, but I haven't talked to Amy in the
Well, no
last
rush,
2
but
days,
we'll
so-
definitely get it integrated into some of our
Fantastic.
upcoming stuff.
Yeah. We have a volunteer who will maintain the database, the local database, and, send it off and enter things that come in on paper, but obviously it's much nicer if we can get people signed up online because it's faster. And as soon as you're signed up, the next month you get a book.
Do we have any more questions?
I was just going to mention partnering with Public Health WIC.
Yes, thank you. We've talked with, actually, everybody that I know that goes into the home has agreed to do it, both in here and in North Lake. So.
Have you talked with Head Start?
Somebody is supposed to, and I'm not sure where that stands. And also reaching out to the Hispanic community. And I'm hoping we get the flyer translated into Spanish.
Thank you, Margot.
Thank you.
Going to the next item, this week we received the latest incentive progress report for Lake County.
Today.
Oh, we got it today?
I forwarded it to you. I wasn't going to talk about it, but the freshest data came. So there's 2 pages of the data. The first one is for the Eastern Oregon Coordinated Care Organization as a whole. The reds are meaning we're not meeting the measures, green means we are. If you turn the page over, it's specific to the Lake County claims data, and we can review that real quickly. As a reminder, the actual incentive measure is on the left-hand side column. The target that we are trying to reach for 2017 is the second column. The third column, where it's green and red, are the rates that you have achieved in Lake County as a whole. And then the fourth column is the numerator and denominator. So for the first example, we have had 37 adolescent well clinic visits out of the 183 that are eligible for this service. And in order to be able to meet the measure during the month of December, 31 of those visits would have had to have happened across all of Lake County. So these aren't specific to each individual clinic. The 3 clinics that have people assigned to them in Lake County, Lake Health Clinic has about 1,030 people. Warner Mountain has about 137. And the Lapine Christmas Valley Clinic has 386 people assigned. So each one of those clinics gets their own report that looks like this, but collectively for Lake County, which is what we're concerned about as a CAC, we're there. Childhood immunizations, 2 more to go. As soon as a child turns 2 years old, you retroactively look at their immunization status. So when they turn 2, if there's a couple more that turn 2 in December, we'll go back. It looks like we need 8 more colon cancer screenings to meet that measure. Advantage Dental and the school activities, we've met the sealant measure. Developmental screening, we need 14 more of the screenings for the kids age 0 to 36 months. Effective contraceptive use, it goes to 20. We need 20 more of those, but sometimes they ask the clinic managers to go back in, see if a woman's come in, and then do a chart review to see if they've already had a tubal ligation or a hysterectomy as a, and then you just add that number code to a claim to catch it up. Ambulatory care and ED utilization. We've never met this measure in Lake County or as the EOCCO as a whole. So this is emergency department use. This one goes backwards. If we have 290 more emergency room visits from Lake County residents, then that green will turn red. But if you look at the numerator and denominator, so far there's only been 670 through 11 months. So if you do that and say, you know, what the math is there in terms of per month, and you have 290 left in order to be able to still make it, it looks really good. And that was a particular problem here in Lake County. If you remember, we talked about a number of times that people would call the clinic and they'd figure out that their doctor was working the emergency room, so they'd just go down there. So I don't know what has happened. We're gearing people the right way, but that's a good sign. And then SBIR, screening, brief intervention, and referral to treatment for alcohol and drug use, you have met that measure already. So any questions on that?
I have a question, Paul. So speaking with the clinics and the public health department, we should be green in 5 measures instead of 3.
We should be by the time we report for December.
So the deadline is December and?
December 31st, and then there's a 90-day claims run out because everybody doesn't get their claims submitted,
Yeah.
which is why we don't know whether we met the incentive measures or not until June of 2018 for what we did in 2017, which delays us getting the money to you, which makes you have to work over Christmas to submit your grants. That's just how it works.
Yeah, poor Christie. Yeah.
It does. I mean, there's just no way around, you know, making that Oregon Health Authority score better. So obviously there are other incentive measures, but these are the claims-based ones that we see.
Oh, the childhood immunization measure?
Yes.
Is that reflecting the data as of last month, or is there a lag in that data as well?
It went through 11/30/2017. So any kid that turned 2 during those first 11 months of 2017, as soon as they turn 2, they're in the denominator.
Got it.
And then the numerator shows, you know, when they look back into the alert system, which we've had some problems with, which is the immunization registry, because kids move around a lot, and you don't want to over-immunize them if they move from, you know, Lakeview to Bend or something like that. And then that statewide registry determines whether they've had the full complement of their shots. So we need a couple of kids to turn 2 in December, right?
Darling, can you help us out?
Our 2-year-old turned 3.
Paul, this is Mary Ann from Advantage. I just have a question for you. Do you have the latest data, like as of November 30th data, or are you still looking at the October report?
No, the November 2017 report came this morning before I left to come down. I can send that to you and Mary Ann. But it had dental sealants here at 70 completed out of 222 eligibles, and had you at 31.5% with the target of 20%. So you're well above it.
Great, thank you.
You bet.
So we're finishing up our adolescent welfare visits, the last push for those. So I think I have 17 more scheduled between now and the 20th, and we're making some calls to try and get those last 15. So, you know, assuming nobody cancels, we should be, I don't know if we're gonna finish above, but we did give it a good shot with that health fair. It was really successful for us, so.
Well, yeah, and it's not just on you. You do have, you know, the bulk of the patients, but there's still 500 more that go or assigned to other clinics, so.
Paul, do you know how soon we'll get the Lake Health District progress report for the clinics, not the county?
They get those.
Yeah, when will we get it?
It should be coming soon. I mean, you get a report, you do get it, right? You know.
Yeah, no, when I get it.
You have to go through and
Right.
it's secure data.
Susan, we should meet the colorectal, right? Like,
Yeah.
like there are 8 patients, we need to meet the target.
I think I have that many sitting on my desk in the folder they handed me last night, so those will get billed out and we should
meet it.
we
as
should
a
meet that
county.
one. So that grant really, that process worked well for us.
Good.
And I think we may meet in effective contraception also
Yes.
right now. We did the manual chart scrubbing process.
Great. again, you know, once there'll be a final one, obviously, but then we'll probably have to wait until April before you'll start getting these reports again. Remember, we just got these ones that have how many you need to get to meet it beginning in August of this year. So this format really, I think it makes it more tangible in terms of understanding what you got to do to make it work. Thanks.
Thank you, Paul.
Thank you.
Going to the next agenda item, last couple of weeks we have had meetings regarding the 2018 incentive measures. I wanted to bring the council up to date with the progress. For the non-competitive, I've also just written them down on that board.
You want me to move that over here?
Thanks, Arun. So in our last meeting, we decided on, for the non-competitive incentive. Yeah, I think that should work. We decided on the weight assessment and counseling for nutrition and physical activity for children and adolescents, or in other words, obesity for ages 3 through 17 years. Next, we decided on diabetes, poor control, developmental screenings, and timeliness of prenatal and postpartum care. For the competitive, we had separate. For the competitive, we again decided on adolescent welfare, which is we'll be conducting another teen health fair next year. We decided on colorectal cancer screening and cigarette smoking prevalence. Speaking of timeliness of prenatal and postpartum care, we spoke with our nursing staff, inquiring about programs we have launched in the past to support this incentive measure. So our clinics have a Bob stroller program for the expecting mothers, and we also have quarterly classes for the mothers. And
It's a really
top of the line.
Yeah, very fancy.
Oh, a stroller. Okay. We have the cribs too.
Well, everyone has a flyer on it. We need to talk to Megan about that. Yeah.
However, when we spoke with the staff, they said that it's not been a particularly successful program. Even I think the turnout for the quarterly classes for the expecting mothers hasn't been very good. Dela, unfortunately she couldn't be here today. She suggested an idea of providing incentive to the mothers, which we thought was an interesting idea. And so we are still on the fence with if we want to choose this incentive measure or go ahead without it. I want to have a discussion. Does anybody have any comments or some ideas that?
Can I say one thing
Yeah.
about the stroller? So Megan Cruz is our OB nurse who is heading up this Bob stroller program, and it's set up so you have to do 8 of 10 things on this list. You have to show up for 10 doctor's appointments. You have to go to the classes, the Lamaze, whatever they call Lamaze now, classes, and go see a dentist. There are, I think, 10 different things you can choose from, and you have to do 8 of them on the list, and then you get the Bob stroller. The incentive measure, specifically prenatal care, is that you need to have your first visit with your provider in your first trimester. And that first visit is where you get the information about the program. So the program only kicks in after that first piece, the prenatal piece of the incentive program. And then there is one of the options you can do for the Bob stroller program is see when you get your visit, I don't remember specifically what it is. It involves talking with Megan, who is also a lactation specialist. And the incentive measure specifically wants postpartum care with your provider X number of days after you deliver. So the stroller program really happens everything in between what we would be targeting to meet the incentive measure. So he's figuring out how to either combine the two or tie together. How do we do that?
So,
Well, but there's a whole handful of incentive measures related to that. Is that correct?
To look in the.
Well, before you even start, effective contraception,
Right.
right? I mean, you
Which
know.
happens at the beginning and the end.
Yeah,
right?
so, I mean, half of Oregon births, not just EOCCO plan people, but half of Oregon births are unplanned.
Right.
Yeah.
So, I mean, that starts with one key question. If they say they want to get pregnant, then we nail them with, not nail them, but we get them on that program and get them on the prenatal vitamins and make sure that they know if they get pregnant to get in for that first trimester visit. And then once they deliver, we have developmental screenings to tell them about, immunizations to tell them about. And then John makes sure that they're not in postpartum depression with his integrated home visiting program where, what was it, John, 30-something% of
28%.
28% have postpartum depression. And nobody's really out there actively looking for it, which is what this program does. So, I don't know. There's just a...
So you mentioned incentives, is that to get them to those quarterly classes that you talked about, or?
To improve this particular incentive, our clinics are designed that they give out free quarterly classes to expecting mothers so that they show up and yes, so attending the quarterly classes probably is not to capture the incentive measure. Or we have to come up with an idea that, yeah, we can reach the target for this incentive measure.
Dale was suggesting about something for the moms. She, at first when she was thinking about this, was thinking about diapers and whatever you can get for the baby, but she thought to get the moms to show up for that postpartum appointment, something, a spa day, or get your nails done or something might be more incentivizing for mom who.
Oh, yeah.
Arnie wants to throw him a baby shower.
They have to push them, don't look around people.
We've also talked a little bit about partnering with public health to encourage the early prenatal visits and helping them partner with us to get their, choose their provider and make sure that they're paying out to the appropriate clinic for the appropriate provider that they want to see for that, and making sure that we go ahead and get that first appointment made early, so it's not all of a sudden, hey, I'm 12 or 15 weeks and I need to be seen today, and our docs are booked because there's so many OB moms. So trying to encourage that early prenatal care right from the very first positive test.
Yeah, that was one thing that, Megan suggested, is that when they're there with their positive test, then public health is just calling the clinic and setting up that appointment right away.
Yeah, Union County was not meeting this measure because nobody was asking the reason for the visit, and they were just scheduling people out a couple of months. And then when they finally just changed and said, they asked the question, do you think you're pregnant? And they were in right away and had the measure.
Well, and some of our people are coming in on a walk-in day, or they're coming to see a mid-level provider just because they don't quite feel right or whatever, and then, we obviously run pregnancy tests then, and we can identify that in the clinic, but many of our people, I think, initially get that first test in public health. So I think we're missing a big population because they aren't coming to the clinic for that service.
I should say that too, that was Megan's comment about the Bob Stroller program, so they just launched that in January, and I think she said they've had 12 people complete everything. But most of those are the women who were going to do all of those things. It was cool that they got a stroller out of it, but they were the ones who were going to do it. And so how we reach those who...
Yeah. We had 60 deliveries this year, and only 12 of those actually finished everything. So that shows the response rate of people being involved in that. I think a big piece of that is just the awareness that this is available.
Right.
And I think Megan was a little bit... was talking about how we need to make it more of a public knowledge, or just let the right people know that this is a program that's available for them. So I don't know, Susan, about with the clinics. I don't know when the prenatal visits begin, but I feel it might be a good idea to sort of combine the prenatal postpartum care along with the stroller program.
I think that integrating would be would be great. We just have to kind of figure out the game plan on how we're gonna link them so that it really aligns with the measure. And I think a big part is the awareness of how important that prenatal care is. I think having seen that, you know, they're not delivering babies in Modoc County anymore, so all those moms are coming either here or going to Klamath, and we have a hard time getting some of those moms in. I mean, even moms who have had 2 and 3 kids, they're no showing their appointments, or they're not, you know, not responding and getting their tests done. They're not compliant. They're, you know, it's time for your every other week appointment, and they'll miss 3 out of the 4, or, you know, whatever. So kind of trying to find a way to reach those moms and let them know how important that, you know, I mean, we had one that even delivered at home and was then came in, but then was non-compliant again. So it's like, we're missing the boat somewhere. So we've got to figure out how we can reach that population that either doesn't know or doesn't know it's available to them, you know, and figure out how to get them.
Is it mostly people who are like far out of Lakeview where it's a major production to get here, or do you know?
You know, it doesn't really seem to matter. Some of them, yes. Even ones that live in town have transportation challenges or, you know, what have you. So, because I've kind of watched that trend a little bit too to see, you know, is it our patients that are traveling from, you know, North County or, you know, whatever. And it doesn't really seem to matter. It kind of is across the board.
Well, last year, or last month or 2 months ago, I provided a breakdown of where EOCCO plan members were by age and gender and zip code.
Okay.
So there were 41 EOCCO plan members under the age of 1. So they're out of the 60 births, 41 of them are part of this incentive measure. The other 19 aren't, but I'm sure you're offering the stroller to them as well. But 23 of them were in Lakeview proper. There were 3 in Paisley, 1 in Plush, 2 in Silver Lake, 8 in Christmas Valley, and 3 in Fort Rock. So I'm guessing Fort Rock, Christmas Valley, and Silver Lake are all delivering in Bend.
Yeah, probably. Right.
So you can even cut that down more. So, but essentially that's why we wanted to give you this too, just so you can figure out how to guess how many between the denominators on this page and where they are. You kind of know whether to just target Lakeview or whether you really do need to go campaign-wide. So.
With the stroller program, is it, you said Megan, does she track for the women? Are they in charge of tracking it on their own?
I think they get a checkoff sheet and they turn it in to her at the end. So they have to be responsible, obviously, for keeping that during that.
Does she know, like, if there were X amount of women that really wanted to complete it, but for one reason or another, there was one thing on their list they didn't get done? Or I think, does anyone check up on that to say, hey?
I have no idea, honestly, what Megan does. I know she gets a list of all of our OB patients that have received those packets.
So what I understand is that when we were setting up the program, the idea was to have the checklist available in the clinics when they come for their prenatal visits, to give the checklist to the parents and tell them that make sure to complete the checklist. If you have questions, call Megan. And then at the time of delivery, or probably 2 weeks after the delivery, talk to Megan and show the checklist and get the stroller. And they had to finish, one of the things on the checklist was a lactation consultation that they can get after delivery, 3 weeks after delivery or something, and that's when they get the stroller.
So I'm just wondering if there were, I don't know, women that wanted the stroller and just for whatever reason didn't complete something on the list.
So I think there were some things that we were not sure, like a visit to a dentist was one of the things we were not sure. If the mother wanted to complete it but didn't get the chance, the insurance didn't cover it. So I think that we came up with something with Advantage Dental to waive the fee or something if they were part of the program.
And she said that the complaints that she has heard is not from women who are missing it by one. It's, I did 2 of these things, I don't understand.
I mean, I know a bob stroller is a huge incentive, but
$579 is what.
Yeah, that was for a double one, but yeah, but they are almost $500. Yeah.
is there a way to work in like a smaller incentive, like halfway through, you,
Get a wheel.
I don't know.
I mean, you can just something like we did with the kids, like you get to this
Right.
landmark and you get
Yeah.
something, and then to incent you for the next
Even just like
10 months
a
of
gift
lifetime.
card to buy some maternity, like a $20 gift card to buy maternity clothes, or nice, because I know prenatal vitamins are expensive, a nice bottle of, I don't.
Bottle of what?
Bottle of tequila is good.
If the checklist could be made really simple and put on a magnet that you give them and they can put it on the refrigerator so it's nearby and in their face, something like that might help.
And I like what you're saying about like having somebody check up on them and making sure that they know. Sometimes you need someone calling you like 10 different times. Oh yeah, I'm supposed to do that. I mean, it's a whole nother job. But
What? Have we gotten the people trained up from the community health worker program yet?
I think so.
I don't have anyone in my clinic, but I think the program has finished.
Well, yeah, it was Ryan.
Yeah, Dela finished. Yeah, it finished last month.
Dela went through it as a community health worker. Well, the follow-up stuff that you're suggesting is community health worker activities. The MAs and the folks at the clinic just, they're already overwhelmed.
Dale's calls.
So do we want to focus on this incentive measure? You think we have a way of improving it for the next year? Or we want to plan more on it?
It seems like you need to get the people, the players that are involved in that in the room and make a systematic kind of chart of how that would work.
Okay.
What is the option if we say we don't want to choose that? Are there other incentive measures we can choose from?
We can, or we can just decide on 3.
Okay.
Didn't we decide that was one of the new measures for this year?
That is.
That's one of the reasons why we wanted to target it, because it's something we don't have a process for in place already.
I'm sorry, I think obesity was the new measure.
Oh, the childhood obesity was the
Yeah.
one. See, I thought we targeted one.
That's a book type.
How can we get a baseline data? I have no idea where we're at for the prenatal postpartum. Where do they get those numbers from?
We would get them from MODA, but they're not claims-based. That's why you don't see them on the report.
So they are not claims-based, prenatal and postpartum here? Okay.
I guess I don't know how they're gonna track that, because you only build a global at the end, so that's very difficult to report on.
Well, some of them are chart-based, right? There's an actual chart review and.
Yeah, the worksheet or something.
Paul, you said they are not medically claim-based?
Say it again.
It's not claim-based, the prenatal and postpartum?
No.
Because that's all.
You get a global payment for that, which means that you get paid once for the whole bundle of services that are provided.
Okay, because it says claims over here in the EOCCO document.
In 2017,
Yeah,
well, eventually you're going to make the claim for the
okay.
actual,
After the big forms.
yeah.
Well, going to the Adolescent Welfare opt-in grant, which is another teen health fair. So we got some updates from the EOCCO regarding if we need to get the welfare visit done during the fair or probably outside or later. So the EOCCO told us that the adolescent welfare visits do not need to take place at the fair to count towards the incentive measure, which will really help us out.
That's huge.
And you'll hear on Tuesday next week that they really are encouraging that when that event is done, there is a clue.
Okay, so
That's
it's
going
not
to be,
confirmed
that's
yet?
going to be ranked higher than one that is more, you know, referring people to get a clinic, an adolescent well visit.
So, do you have any suggestions or things that have been successful in other areas, how they're accommodating that? Because, I mean, we're talking that it takes,
Stations in schools,
well,
but we don't have good, we haven't had good timing for when things can happen at the schools, but.
the providers are concerned that they don't have adequate privacy or time to do it in that fast-paced setting. So if we're looking at, I mean, I have 2 providers that I'll kick them out in 30 minutes, everybody else wants an hour. So if we're gonna see that, I mean, we scheduled, what, 60 kids?
Yeah.
Probably easily out of our health fair. That's a lot of provider time to be done over a, 3 or 4 hour period. So is there some other tools that might help us be successful?
Well, I mean, part of that is, you know, why it's up to 40,000 too, right? You can bring in somebody else to do it.
Yeah, I don't know that that would be super well received by our parents.
No, I understand, but
I guess we could explore that.
And it's seen as done through one of the clinics, on the cover of that one of the clinics, and the parents might be more accepting of it.
Friend of Dr. Gallagher.
You weren't sitting at those parent-teacher conferences.
That's what I was thinking. Seeing the look on the parents' faces at the parent-teacher conferences, they were very clear about who they wanted their kids to see, or else they didn't want them to be seen.
Yeah, they are very, this was a whole new concept for our parents this year. So it took a little bit of selling to get them to understand why their 12-year-old needed a visit. Like, we quit having well-child visits when they were 3. Why do they need, why do they need to go now? So helping them understand the differences between a sports physical and an adolescent welfare check that was a big deal. So that was a big stepping stone for us, and I think we've been fairly successful with that, but they are very protective of who their children are gonna see. So that was definitely, availability was.
But what are they also doing for space? Do you know, Paul, for other places? Because we're having an issue with scheduling, like after school, if we need to host it on site, like getting access to classrooms, to having a quick turnaround to not use the youth, because you're saying they brought it up for this amount of money. We might need to keep our physicians because of the rapport they built with families, which I agree with. However, how do we maybe use some of that money to provide adequate spaces there for them to be seen?
Some places, they actually have done it in the gyms, and they set up
big screens,
beautiful areas. I mean, they're portable privacy screens.
I felt like the physicians really adamantly vetoed any sort of offsite, because we suggested having partitions and things like that, and they were like, no, we want a room where it's private. We're gonna have conversations about drug use and contraceptive use and these kind of things. We want to make sure that we have that confidentiality. So, I mean, I know, and part of it is getting the providers on board and to understand why these things are important and how it needs to work. But we still have to let them feel like they're doing their job.
And you could use the classrooms, you could use the locker room.
yeah, there was one that mentioned, and the provider in Burns didn't like it when she was stuck in the locker room.
Thank you.
And up in Hamilton, this is before they would do this, when they would do the sports physicals, you'd come into the gym, you'd do all your work, and then you'd go into the locker room, that's where you saw your doctor.
And on average, how long are they spending? Do we know? How long the providers are spending?
I couldn't say, I mean, that again, it's a sports physical, that wasn't the well-child. And all the parents, a big portion of the parents would all go.
Well, and we have a similar sports physical event, and we tried to think about how we could integrate the sports physicals in the adolescent welfare checks, which we could probably accomplish it, but again, it's a time factor. It's like we can't put all the docs in the gym and run everybody through in an afternoon. Like, it's not feasible for that to happen. So we're kind of trying to figure out what the best.
Just one night.
Well, buy-in is difficult, so if you can get them to show up once, that's a big deal. Getting them to show up on 2 or 3 different nights. That's why we thought if we pre-scheduled them, and like this year we did them over like a 3 or 4 week period. that seemed to work pretty well, but getting them all accomplished during a health fair, we were like, this is gonna be really challenging. And we have some ideas on a good start, but if we don't have to have them all accomplished that day or that evening.
Yeah, they like that. The other side has to be a short time frame, which 2-3 weeks, if you're really crushing them together works. The other, just looking at the numbers from last time, you need about 70 for plan patients.
Yeah.
But you're doing all the kids.
Yeah.
So that's what makes
Exactly.
some of the work a little bit more difficult, I understand.
Yes, you know, we have as many or more commercial pay patients as we do plan patients. So, you know, and we can't obviously treat one different than the other. They don't need the same healthcare, so it's
And one of the things that, you know, if people are sensitive to who they're going to or where the privacy and that is, understand next year the effective contraception, the bottom age is 15, not 18. So that's going to, in some of our communities, cause a little stir.
That was one of the reasons that our providers, they actually came back to us on our template, is that we want effective contraceptive on our template. We want to have that conversation. It's important to us. So I think our providers are, that was good news for us.
So we had another question for the EOCCO, if we could only conduct the teen health fair after the 365 days.
Say it again.
If we could only conduct the health fair. So we conducted it in November 14th this year. So we thought we could only conduct it after November 14th of 2018. Yeah, so they told us that we have to conduct it every calendar year, and EOCCO will pay for the visit regardless of what the patient's last well-care visit was. However, we still have to speak with other insurance companies if they are also on board.
The EOCCO has had as a policy that they'll pay for as many adolescent well clinic visits as occur. If they went to one clinic, 2 clinics somewhere else, and they got 3 in 1 year, we'll pay for that.
Okay.
Now, the other insurers can't speak for them.
Okay. Yeah, so once we find out from the other insurers, then we have more flexibility with what date we want to conduct a health fair.
Yeah.
And so in our last meeting, when we discussed the cigarette smoking prevalence, opt-in grant, we didn't know what other organizations we should collaborate with so that we could meet the target for that measure. Yeah, so again, putting it out there if anybody has ideas. Francie left. I think Francie told us the last time that she could look into what program, what we can offer to improve that incentive measure. If anyone else has any ideas about cigarette smoking prevalence. So again, we are on the fence with that. We don't know exactly how to go ahead with that, and
sometimes you can work with your local employers and promoting smoking cessation. And your health department is, I know up in our area, they're the leaders in the whole smoking cessation. Also, there's a big campaign, smoke-free zones, both in hospitals, but work sites.
Okay.
Maybe partnering like with
So,
the prison and BLM and Forest Service, big employers.
They have a TPEP tobacco prevention education coordinator.
They do.
Yeah, Jill Harlan is that.
So I hope that she would be involved in at least a policy bullet that you guys were talking about. But you got to remember now, the incentive measure this year, it just looked at the charts and said, was it recognized and asked? And did you have a percentage? Now, next year it's going to be, can you reduce the number of people who said yes to that question? And so it's going to be referrals to the MOTA health coach or the quit line or things like that that are ultimately going to see if you can meet the measure. At first it was, can you tell us how many hypertensions and diabetics you have?
Correct.
Then it became, can you keep the hypertension and diabetics under control, which is a totally different thing than just being able to say, how many do I have? So all of these things, the childhood obesity one, next year is going to be, are they measured? And is it charted? And then in a couple of years, it's going to be, can you reduce the overall BMI of your children? I mean, that's what we get measured on. So this is just the introduction, but the tobacco one is, it's going to be,
So
the best thing to do is to have people not start, right? So that your denominator is very small.
Right.
Because it's going to be hard to get people to change, you know, so emphasizing the prevention, I think, is, in the long term, the smartest thing to do.
So with this cigarette smoking prevalence grant, we are looking at reducing the smoking. That's what the grant is to be used for prevention education?
Leading community awareness campaigns that support reducing tobacco use, text messaging, tobacco cessation counseling with the tobacco quit coach. And then another bullet says health system, public health collaborations, such as implementing policies to support tobacco cessation. That's the stuff Rod was talking about.
Okay.
And that, lots of times, is one of the biggest steps that you can do. And then you start getting the success stories out there. I know at the hospital, one of the employees at the hospital who quit smoking, he then talked about the money he would spend on cigarettes every month. He was able to buy a pickup light. And we would throw that story out there all the time.
Well, I mean, basically, though, the policies that make, you know, OHSU nowhere on campus, you know, to have people have to leave somewhere, not being able to smoke in your private car in the parking lot of the hospital. I don't know how it works here, whether they can do that or not, but the more difficult you make it for somebody to smoke, the more likely they are to quit.
And I could say to Anthony's in Pendleton, it's a smoke-free zone. They had to walk all the way out by the highway. And
That's what they do.
395. And it was kind of funny though, where they were standing is right next to the St. Anthony sign smoking.
Yeah.
Yeah, that's a long walk.
Yeah, it is.
Out of the prison, they're completely tobacco-free grounds now. And people take their 15-minute breaks and they jog out across the parking lot and they stand out and they chain smoke as many cigarettes as they possibly can in their 15-minute break and they run back in.
Been there and done that. Years ago.
Do we have any more comments or questions?
I have one, and it doesn't matter if it's not up here because it doesn't go through the cap, but we are also going to be doing the emergency department utilization opt-in grant. That will be a partnership between the hospital, the clinics, and mental health. So, here's my answer.
Are we targeting people with severe and persistent? Okay, good. And then is it, what clinics are going in with the colorectal cancer screening?
We're going to do this same model we did for this year.
Right. Is it just like Health Clinic or
It's one amount.
We talked at the older adult collaborative meeting today, we talked about having an adult and including be on this as well. And do you guys have Norman, is it
Nolan Nicole?
Nolan Nicole?
Because I did ask
Or Strowman Nolan.
how big is he? I asked maintenance how big a one I could order, and then I found out that you guys had one, but we were just borrowed.
Well, we're the American Cancer Society, to the Western Division out of Portland. They'll loan it. That's who we're getting it from.
Jen says we can't put it right in the entry to the hospital, which I'm fighting. What is it? Nolan the colon.
It's a big inflatable colon that you walk through and take selfies with Paul. They do.
You think
Can I bring it to the schools?
Well, they don't need it.
It's really fun though, because
Hey, adults gotta have fun.
They can tell their parents.
and it's the kids going, oh, what's that? And dragging the parents, and the parents are like, no, I know what that is.
So we can advertise the colon at the schools.
Yeah.
That, hey, bring your parents to.
Yeah.
Put the bouncy house at the end of the.
They made you walk through it to get to the Harney County Fair. That was the entrance.
But we had a great response rate from the EOCCO members when we used the incentive dollars for the colorectal cancer screening this year. We had probably between 35 to 40% response rate once we sent out the kits to the patients. And I think we had 2 positives which were followed up.
Yeah, I have another, that batch that they handed me last night, that I need to look at to see if we had any more positives. But, I mean, we had great response. People were like, here's my card, where's my gift card? Like, they were all about it. And I had, my staff thought it was great that I got all of the samples to my attention. That was a lot of fun.
So related to like the social media thing, Harney County, which did the focus groups like Lake here, picked up on the piece of people telling their story, like the smoker or whatever, and a lot of their glossy publications had stories about people who had gotten screened and in the community. And then I went into a convenience store and like the rack of the free the Roundup or whatever, there was a picture of somebody. They have it in different places. So
I last time I was here, I actually had lunch over at the senior center and sat down with a group of gentlemen there. And after we got to know each other a little bit, just setting over a meal. Guys can do this. I actually shared a story, actually a not good story of my uncle who just turned 80. Ended up having and is going through chemo treatment now. He never had any sort of screenings or anything in his life. He was not that kind of guy. And so then I asked these guys, so when did you guys have yours last? And they were very open with me. They were talking about, one of them said, I had it 7 years ago. Another one said, I've never had one. It's too hard to get in to see a doctor, all that sort of stuff. And so if you go in there and you just sit down and you have the conversations, and then you can tell them the easy way to do it, I think we could have a lot more individuals. I call them tabletops.
Thanks, Rod. The next CHIP meeting will be on January 11th, 2018.
I can almost assure you we will not have new data, because I think it's kind of around the 14th or 15th.
Very cool.
The meeting is adjourned. Thank you.